Unfortunately, a heart attack is a condition that we hear about all too frequently. But do athletes, or those who are fit and athletic, need to worry about heart attacks? Recently, there have been reports of fit and athletic individuals being hospitalized with possible heart attacks. This raises questions about what actually occurs during a heart attack, whether fit people need to worry, and if recovery allows for a return to sports like marathons and other physical activities. Before we dive into the details, if you find this information helpful, please take a moment to like this video and subscribe to our channel for more content on health and wellness. To understand heart attacks, it is helpful to look at the human heart. The heart sits in the thoracic cavity, between the two lungs, within a pericardial sac. The outer portion is called the epicardium, which is mostly made up of epicardial fat. Beneath this is the thick, muscular layer called the myocardium. This myocardium, which literally translates to heart muscle, is the focus during heart attacks. Heart attacks are technically called myocardial infarctions. Infarction means an area of dead tissue due to a lack of blood flow. Therefore, areas of the heart muscle can die off during a heart attack because they are not getting the proper amount of blood. The heart gets its own blood supply from the aorta, the largest artery in the human body, which is about the size of a garden hose. The first set of branches that come off this artery go to the heart itself. These are the right coronary artery, which branches onto the right side of the heart, and the left coronary artery, which sends branches onto the left side. If a large enough occlusion or blockage occurs in one of these arterial branches, it can lead to a heart attack. Heart attacks typically do not happen overnight. They are preceded by other risk factors or conditions, the most significant being atherosclerosis. Atherosclerosis is the development of plaque on the inside wall of these arteries. These plaques can range from very small to very large and severe. Smaller plaques do not block or occlude the blood vessels as much, and many people do not know they have them because they do not develop any symptoms. This highlights the importance of staying on top of annual physicals, blood work, and cholesterol levels. As these plaques get larger, symptoms will eventually develop. One condition that can develop with larger occlusions is angina pectoris, also referred to as stable angina. Angina pectoris means chest pain. It is called stable angina because the pain can be predictable. For example, pain might come on when someone exerts themselves, such as hiking up multiple flights of stairs, but then goes away as they rest. This happens because the blockage is large enough that it does not cause much of a problem during rest, when the heart is beating more slowly. However, as soon as the heart has to work more, it needs more blood, and that blockage prevents the extra blood from getting there during exertion. While stable angina is not technically a heart attack, it increases the risk of developing one in the future. Most of the time, a heart attack develops when one of these plaques inside the blood vessels ruptures. Rupture in this context means the inside lining where the plaque is built breaks open, not that the artery itself bursts. The outer layers of the blood vessel or artery remain intact, so there is no bleeding out. However, when that plaque ruptures, a clot forms in response. There was already a narrowing from the atherosclerotic plaque developing over time, and when that clot starts to develop from the rupturing, it builds up relatively quickly. This can block off the blood vessel or the artery even more. If it happens on a branch and develops to the point where even at rest, this area of the heart isn't getting enough blood, chest pain will start. If this tissue starts to die off or get damaged, that is when the heart attack or myocardial infarction begins. Many have likely heard of the typical heart attack symptoms: central substernal chest pain that can radiate to the arm, up to the neck, and even to the upper abdomen and back. People can also experience diaphoresis, which is sweating, as well as anxiety, nausea, and various other symptoms. When someone arrives at the hospital with a heart attack, several interventions occur. Almost every patient will be started on aspirin, a type of blood thinner. Many patients will also be initiated on medications called nitrates, which are vasodilators that can help open up the arteries feeding the heart. People can even be progressed onto stronger blood thinners or anticoagulation therapy, which helps slow the progression of that clot. Beta blockers and statins might also get involved in this process. Most people who have a heart attack will go to the cardiac catheterization lab, or cath lab. Before discussing what happens there, it is important to touch on the idea of a mild heart attack versus a massive one. A mild heart attack would involve one of the smaller arterial branches being blocked by a smaller clot. While this area of the heart is still important, it is less severe than something like the widowmaker. The widowmaker is a nickname for when the large arterial branch called the left anterior descending artery, which is a branch off the left coronary artery, gets blocked high up. Everything downstream, a massive area of the heart, goes without blood, which can be life-threatening. Someone in that situation would likely get funneled into the cath lab immediately, whereas someone having a more mild heart attack who is responding well to medications might get triaged lower down the list. In the cardiac catheterization lab, imaging called an angiogram is used. An X-ray machine with dye lights up the blood vessels of the heart so the cardiologist can see them clearly. The cardiologist will use a catheter, typically inserted into the radial artery, though the femoral artery can also be used, and float it up to the heart. Because of the imaging, they can see the areas that are potentially narrowed or blocked, and can do an angioplasty or place a stent. In an angioplasty, they stretch the part of the artery that has been narrowed. They can also place a stent, typically a metal mesh, to keep that artery permanently open, re-establishing blood flow. Regarding the future in fitness and athletics for people who have had a heart attack, there are plenty of people who have had a heart attack, an angioplasty, and a stent placed, and then participate in therapy and decide to make lifestyle changes to improve their fitness. Some even go on to run marathons. It is amazing that this type of recovery is possible. While there are situations where strengthening the heart or participating in certain activities might not be advisable immediately after a heart attack, and each individual situation needs to be addressed based on severity and other risk factors, for the most part, people can have quite a recovery and participate in various activities. Obviously, the ideal situation is to avoid having a heart attack. While it is incredible that treatments exist and remarkable recoveries are possible, prevention and reducing the risk of having a heart attack in the first place should be the focus. The main goal is reducing the risk of atherosclerosis or plaque buildup because it is often silent in the beginning and symptoms do not appear until the plaque has built up to a certain degree. Reducing that risk involves things like exercise, diet, and knowing what is going on with the body. The data is clear that exercise, especially cardiovascular exercise, reduces the risk of developing cardiovascular disease, including atherosclerosis and heart attack. When we exercise, the heart gets stronger and develops tiny new blood vessels called capillaries that penetrate into the muscle tissue, giving the heart a greater blood supply as it gets more fit. Fitness influences 4 key things that contribute to cardiovascular disease risk. It can help reduce overall body weight, reduce cholesterol levels, reduce blood pressure to healthy levels, and reduce the risk of diabetes. All 4 of these factors should be considered when discussing cardiovascular risk. Diet also influences these factors. While diet can be a controversial topic, there is not one single perfect diet for everyone. Many different diets can be considered heart-healthy and help reduce body weight, cholesterol, and the risk of atherosclerosis and heart attack. Generally, most food should come from whole food sources, and the overall amount of added sugars should be reduced. Occasional treats are acceptable, but moderation is key. Knowing what is happening inside the body involves lab tests during routine physicals, such as a lipid profile, which includes triglycerides and cholesterol. Atherosclerosis is closely related to certain types of cholesterol. Some people with excellent exercise routines and healthy diets can still have elevated cholesterol levels due to genetics, increasing their risk. In those situations, it is important to discuss strategies with a medical provider, including lifestyle modifications or possibly medications. Routine lab work is crucial for knowing what is going on. While healthcare can be expensive, prioritizing cardiovascular health is important. Beyond the foundational pillars of diet and standard cardiovascular exercise, taking a holistic view of heart health requires us to look at less obvious, yet equally critical, contributing factors. One such factor that is frequently overlooked in fast-paced medical discussions is the profound impact of chronic stress on the cardiovascular system. The mind-heart connection is incredibly strong. When we are in a constant state of high alert due to work pressure, financial worries, or personal anxiety, our bodies continuously release stress hormones like cortisol and adrenaline. While these hormones are vital for short-term survival, the classic fight-or-flight response, having them chronically elevated can be disastrous for arterial health. They can lead to sustained high blood pressure, increased arterial inflammation, and can even trigger plaque ruptures. Therefore, stress management techniques such as mindfulness, meditation, deep breathing exercises, or simply ensuring you have time for hobbies you enjoy are not just luxuries. They are physiological necessities for maintaining a healthy heart. Closely linked to stress management is the critical importance of high-quality sleep. In many cultures, sleep deprivation is sometimes worn almost as a badge of honor, signifying hard work and dedication. However, from a physiological standpoint, lack of sleep is a severe stressor on the heart. It is during the deep stages of sleep that our blood pressure naturally dips, giving the heart and blood vessels a much-needed period of rest and recovery. Chronic failure to get this restorative time, typically recommended as 7 to 9 hours for most adults, keeps blood pressure elevated for longer periods. Furthermore, poor sleep disrupts hormones that regulate hunger and glucose metabolism, often leading to weight gain and insulin resistance, both of which are direct pipelines to developing atherosclerosis. We should also refine our understanding of exercise as it relates to the heart. While steady-state cardio, like jogging or cycling, is fantastic, we must not ignore the power of resistance training. Building and maintaining lean muscle mass is not just about aesthetics or strength. It is a premier tool for metabolic health. Muscle tissue acts as a glucose sink, helping to pull sugar out of the bloodstream and improving the body's sensitivity to insulin. By improving overall metabolic health through resistance training, you indirectly protect the heart by reducing the inflammatory and sugary environment that tends to damage blood vessels. For many patients, especially those in recovery, a supervised combination of aerobic activity and monitored resistance training provides the best outcomes. Finally, for those who have experienced a cardiac event, the journey through cardiac rehabilitation deserves specific mention. It is a structured bridge back to normal life, often starting with very low-intensity activities while being closely monitored by physiologists and nurses. It is this gradual, medically supervised progression that allows someone to go from being afraid to walk up a flight of stairs after a heart attack to eventually training for that marathon we mentioned earlier. It proves that the heart is incredibly resilient if given the right environment and time to heal. This recovery process is not just physical, but also psychological, as rebuilding trust in one's own body after a traumatic event like a heart attack can take time. Ultimately, heart health is a lifelong marathon, not a sprint. It is about consistency in these varied areas: movement, nutrition, stress management, and sleep hygiene that creates a robust cardiovascular system capable of serving you well for decades to come. Investing in health can also mean investing in learning and brain health. Online learning platforms for STEM subjects offer interactive ways to learn math, science, and computer science. Lessons on scientific thinking can help with logical and critical thinking, applying information to real-world situations. Whether for junior high, high school, college, or lifelong learning, these platforms have applicable lessons and courses. Interactive lessons that balance fun with challenge can push learning to the next level.